Perfect. So
Hmm.
that's another one as well. There's a few different ways they reference it in the literature. They have one that's more qualitative in nature, where they use a scoring system that looks at the quality of the movement with certain benchmarks in regards to, what's pelvic positioning, is there Trendelenburg or knee valgus, similar to like the less scoring system for a drop jump. And then there's also a more performance-based one where in the literature they used different centimeters, but it correlates to somewhere between 6 to 8 inches. I prefer to use a 6 inch step because the 8 inch step, if you have a shorter individual or somebody who lacks ankle mobility or just balance, the 8 inch drop off can be a good bit of range of motion to go through. So I personally use a 6 inch step unless I have an individual taller than myself. So they're like 6'2" or beyond. Then I would go to the 8 inch step. Hands on the hips, 30 seconds. How many heel taps can they get on each leg? The other thing that you will see is setting it to the cadence of a metronome. One beat up, one beat down. I'm sorry, 1 second up, 1 second down, 60 beats per minute. And this is going to remove a lot of the momentum out of the equation. And you go for how long they can keep beat with the metronome until it's either provocative or they lose form or they just can't keep up from a performance standpoint. That is a great endurance based test to do with not post operative, but think of like your repetitive stress injuries, patellofemoral pain, Achilles tendinopathy, all of your individuals that come into the clinic that you have a hard time replicating their pain with manual muscle testing or traditional strength testing. That anterior step down is a one that you'll often see people when they hit 60, 75, 90 seconds, they'll start to replicate some of that pain. Um, so those are all different body weight examples that you could use to supplement your current battery. If you have any means of doing isometric strength testing, that's great to do as well. And then
What are your thoughts on the what is it, the Tyndek, the
yeah,
little guy? What are your thoughts on that? I'm trying to get my
yeah.
clinic
So
to maybe get one, so I'm curious.
yeah, so we have them at our clinic.
Okay.
We have 8 physical locations. We have 8 different offices. So for us, the Tyndek was a cost-effective way to outfit each location with a way to do isometric strength testing. So it is great in the sense that it gives you a consistent readout with how much force they can exhibit in an isometric standpoint. The part that's tricky is you have to put some time and effort into how you are standardizing the setup of the test. Because all that the Tyndek is going to tell you, and same thing with handheld dynamometry, is how much force is being transmitted through the device. It is up to you as the clinician to make sure that the direction and the application of that force is in the intended manner, that you're truly testing the extension. And if I'm testing the extension, am I consistent with the angle that I have the knee? If I do 60-degree knee bend one time and 90-degree the next time, we'll get a number for each, but it's not going to mean anything. I think the Tyndek, it's a great thing to add to the clinic. I've seen people use crane scales as well. It really just comes down to making sure you have a consistent and repeatable setup so you're always tracking apples to apples when you're doing that test. The nice thing about the Tyndek, you can look at the force output, the angle at which you have their knee, and the length of the lever arm between the where the device is located on their lower leg at their ankle and the distance from the joint line. And you can get a torque to body weight conversion, which a lot of the research in regards to return to run and return to sport will reference that knee extension torque to body weight ratio. So I am a big fan of the Tyndek. I will say it took us probably a good couple months to really lock in how we were utilizing it. But no, it's a easy, portable, versatile device.
Cool. Cool. Thank you.
Yep. All right. Just to be mindful of time, we've got about 12 minutes left. I am surprised that my kids have not busted through the door yet. So we'll see how long that lasts. We've gone ACL, do we have any questions or any other questions on ACL or anything more career or professional development? And if we don't, I have a challenge for you, or not a challenge, but an exercise for you to do when we get off the call. So, any specific questions on that?
I don't at this time.
Okay. So, what I want each of you to do is I want you to write down 3 things that would be an ideal work environment or career environment for you. So, what are 3 things that if you could kind of map out, these are like my 3 non-negotiables that would really make my work life awesome? I want you to write those down. So, put a little bit of thought into that. That can be anything. That can be working a block away from my house and being able to walk to work. It could be making $1 million. It could be only treating chronic pain patients or ACL patients or geriatric patients or pediatric. It could be owning my own practice, working in a group, only seeing 1 patient an hour, seeing only insurance or only cash, whatever it is. And everybody's going to have 3 different things that probably there'll be some common themes between people because I think we're all generally well-intentioned humans and we have some common themes there, but everybody's going to have a different kind of recipe of really what fills them up personally and professionally. What I want you to do next is the current situation you're in. I'm speaking to the people on this call, but also people who will be watching the recording. So if you're a student, if you're an early career professional, a new grad, or if you've been practicing for a while, whatever your current situation is. And if you're a student, you can think about like a clinical rotation you've been on. Write down your 3 favorite things that you enjoy about being in your current position. So whether that's as a student at a rotation or as a practicing clinician currently, what are your 3 favorite things about what you're currently at? And then the next thing, what are your 3 least favorite things? Of the ones that are your least favorite things, what can you actually change about them? And then at a later date, probably about a month from now, I'm going to reach out to everyone and I'm going to ask them, of the thing that you did not like about your current situation that you identified you could change, what steps have you taken to make that a better situation? All on board with that? Perfect. I am going to do that as well. So I will be joining in on that also. If you guys don't have anything else, I think we can wrap up for the evening. Corey, do you have any parting words of wisdom for the group?